Type 2 diabetes is a clinical scenario where the body does not respond to insulin and you have elevated sugar molecules or glucose molecules that occurs and that leads to problems downstream. Type 2 diabetes increases your risk of heart attack in two ways. One way is the direct effect of high sugar molecules in the body, and the other way, your cholesterol levels in the body. If you can imagine, the heart is an engine, and that engine has fuel lines. And so the fuel lines in this case would be the arteries of the heart. When you have gunk that builds up in those fuel lines, you can have the engine sputter. So in a heart attack, the arteries of the heart, they develop plaque or gunk. In a heart attack situation, that plaque can rupture, causing a clot to form in the arteries of the heart, preventing blood flow getting downstream to the heart muscle. Heart disease is the #1 cause of death among people with type 2 diabetes. Silent heart attacks are not common amongst the general population, but they are more common in patients with diabetes. A silent heart attack is when you don't have the classic symptoms of chest pain due to heart attack. The symptoms of a silent heart attack are minimal at best. It's very important for diabetics to have a good relationship with their cardiologist because folks can have silent heart attacks. And if their risk is relatively high, we can help figure out by various testing, such as stress testing and echocardiography or ultrasound of the heart, to see if they've already developed some sort of heart disease, and we can help mitigate their risk even further. One message of hope that can be taken for folks that have diabetes in regards to their heart health is that you can overcome the scenario of your diabetes by changing your lifestyle. It can reduce their risk to that of someone that may not have diabetes. So lifestyle changes folks can make: exercise approximately 5 to 6 times a week for about 30 minutes a day. And it's usually aerobic exercise where you're sweating by the end of 30 minutes. And usually eating a low carbohydrate diet to prevent their diabetes from progressing, which in turn can make their coronary artery disease progress. My name is Abdallah Battar, and I'm an interventional cardiologist.